Good to see you again, Abdallah.
How you doing?
I see you brought a friend today. Gotta say I'm Dr. Summers. Okay, so have you been to a chiropractor before?
No.
Okay, this is a good visit. Because with what Abdallah's presented with, I think that chiropractic may actually really help you. But for your information, just a little bit about chiropractic again to help educate you. Chiropractic deals with addressing subluxations, and subluxations are when a bone in the spine is out of alignment and it causes an irritation or pressure on this nerve root that doesn't allow it to communicate with the body. So the central nervous system, your brain and spinal cord, they can't communicate. So messages aren't going back and forth, which will affect you and present as pain, and present as decreased range of motion. Different symptoms are affecting the muscles and organs of the body. And that was briefly about the central nervous system, but your peripheral nervous system consists of the nerves that go to your extremities, to your arms, your legs, but also to your organs. And this diagram right here, actually in this book, demonstrates the organs that the nerves innervate, to give you an idea. So if a subluxation is present, these may not be as efficient as they would if that was addressed. So chiropractic essentially is going to get rid of that subluxation to allow the organs, the nerves, the muscles to all flow and function efficiently. All right, so well, with that being said, we're going to present his findings. Abdallah, is that all right if I go over your findings?
After I talk about it in private.
Okay, so
Thank you. It's nice to meet you.
nice to meet you as well. Okay, Abdallah, so from your first visit, when we went over your history and your report and what we found, your findings were consistent with sciatica. Sciatica is an irritation to the sciatic nerve, L3, L4, L5, S1 root level. And to give you an idea of what I'm talking about here is, so L3 is right here, you have L4, L5, and S1. So what we're looking at is an irritation to the nerve that's exiting this area here. And most commonly that's referred to as sciatica, and it's consistent with what you're presenting with. Also, before we go through your findings, I wanted to reiterate that sciatica is a common problem that chiropractic doctors see in patients. And there's a lot of peer-reviewed journals and peer-reviewed articles that have addressed that with different research studies and showing benefits to chiropractic care. But I actually had prepared a list, well not a list, but here is a study in itself that you could review, kind of just going through that, ask me any questions on it. After we get through your exam, I'll tell you your findings. But yeah, so these are some research articles that coexist with what you're presenting with. But a little bit more information about what we found. So when we checked your posture, you did have a right high hip. So there were some things about your posture that we'll address with our treatment plan. And we want to start low too, and I'll explain a little bit more when we get ahead into the treatment plan. But phase one, I really want to focus on the problem that you're experiencing with the sciatica. So that's why I mentioned you had the right high hip. So we're going to correct that posture that could be causing that, and some of that may also be affecting the range of motion in that lumbosacral region, and that's where I was telling you about, right in this area here. You did have some pain on extension and pain on lateral bending and stuff, but so with the correction, the chiropractic care, we're going to help restore that posture and the function there, so the nerve root would be less affected. We did do the orthopedic tests. We found 2 of those were negative. The 2 that were negative, Valsalva and the Kemp's test, were actually for if there was an injury to the disc. You were positive for a straight leg raise, and that was also indicative of sciatica, the problem that you present with. Our neurologic exam told us that your Achilles reflex was affected, that's your S1 nerve root, and also the patellar reflex, which is L4. So that's consistent with the sciatic nerve as well. Your gastroc, that's down in your calf muscle. On the right side, it was a little bit smaller, so that would tell us that the nerve isn't innervating that well as efficiently. So on the right side, that's why the size is smaller. So once we get that irritation off that nerve root, you should have better function or restore the size on your right calf. Also, when we did our motion palpation and just check the restrictions, you did present with some cervical and thoracic restrictions, but we did also find them at L3, L4, L5, or L5, S1. L3, L4, L5, S1. So that area that we've been consistently looking at. So with that, as I told you before, and I mentioned with Kelsey, that if you have a subluxation in that area affecting those nerve roots, chiropractic care correcting that will really help with the irritation of that nerve and should decrease those problems, so you're able to continue to do your active daily living things as far as doing laundry and standing on that leg often. And it said, I mean, we know that you have kids based on the history too. So when we do this care, it'll help you get to do those activities again with your kids and just do common household things. So that's what is wrong. With our treatment plan, what I want to do, I actually write this down for you. But so the treatment plan, we're going to do 2 phases. So we'll have phase 1. Phase 1 will be 3 visits, 3 times a week. 3 visits, 3 times a week for 2 weeks. Mm-hmm. That's what we'll start you at to address the sciatic problem. And like I said, that's mainly to address the sciatic problem. So that'll include adjustments and then also some soft tissue work to improve that irritation. We'll follow that up with phase 2, which will be 2 times a week. Come to the office 2 times a week for 2 weeks. So total treatment plan will be 4 weeks long. The first 3 weeks will be just addressing that the L4, L5, S1, that area, and then the remaining, we're going to get some motion and restore range of function in your cervical and thoracic spine, as well as continue to address that problem. That way there's no degenerative changes there, and you get back to normal range of motion. With that being said, so that will be your treatment plan. Cost-wise, so financially, the visit with the adjustment and the soft tissue work is $60. So we charge $60. Like I said, so we'll begin phase 1 3 times a week for 2 weeks. We're looking at $180 per week times 2, so it's $360. The remaining 120 times 2 is going to be $240. So total treatment cost for 4 weeks will be $600. However, your insurance covers 50% of that. So all you'll pay is $300. So the cost for the treatment plan will be $300. Let's see here.
It's a lot cheaper than surgery, huh?
A lot cheaper than surgery and a lot less addictive than any type of pain medication.